Hello everyone, welcome to Medidia. My name is Ahmed Jamil Malik. I am a Medidia intern and also a medical student in Sheikh Zayed Medical College, Lahore. The topic of today's discussion will be how to write a scientific abstract for a journal, for a meeting, or for a conference. Before starting my discussion, I would like to thank my mentors, Dr. Faja and Dr. Tariq, for helping me in compilation of this presentation. Now I will quickly begin my discussion regarding the writing of the scientific abstract. So what are the major learning outcomes of this presentation? So by this presentation, we will be able to learn what is an abstract, what is the meaning of an abstract, what are the types of abstracts, what is the basic structure of an abstract, what are the common mistakes we do while writing an abstract, and what are the ways to make our abstract look very efficient and very nice. So, what is an abstract? An abstract basically is a short and concise summary of your research work. It can be a manuscript which you submit in a peer-reviewed journal like PubMed. An abstract is also an important part of the research which we used in a conference. So regarding the guidelines of an abstract, they vary from one journal to another. The word count also differs from one journal to another. For that, you can go to the specific website. You can just tap on the submission instruction or the instruction for authors. There you will find the specific word limit for the abstract. Usually it is less than 300 words, but like I said, it varies from one journal to another. This is an example of an abstract. I'm using this example for the sole purpose that we have a picture of an abstract in our mind. This is an example of an abstract that was done last year in Sheikh Zayed Hospital. This has not been published yet. All we have to do is just look at the subheadings of the abstract. That it begins with the background, then we go towards the objectives. What are the various methodologies that have been used in this abstract? What are the results drawn? And how these results in the conclusion section help us in our field. So this was basically a knowledge, attitude and practices, a CAP study for assessing the compliance of doctors regarding personal protective equipment. So what is the purpose of an abstract? Why do I need to write an abstract after the research paper or before that? So first of all, you need to inform your readers about the contents of your research paper. Once they know the contents, they will be able to determine whether this research of yours is related to their own work or is it not. And third of all, what are the key findings of your research? What are the main highlights which we are trying to find through your research paper? And in just one line, an abstract basically provides an overview of the full research paper. Now, what are types of abstracts? There are majorly two, but it can be up to three types of abstract. Informative abstract, descriptive abstract. Informative abstract is basically an overview of the whole research paper in a paragraph or in a single page. Whereas descriptive abstract is very small, is very brief, and it explains only the purpose, the problem being discussed, and the methods being used. It does not relate to anything to conclusion or results. Now, what key information do you need to convey to your readers in this abstract? So first of all, what was the objective of your research? Second of all, what methodologies have you used? Third of all, what were your results? And fourth, what conclusions have you drawn from your result? So quickly, objectives, what were your methods, what results have you drawn, and what conclusions can you derive from the results? So let's say I'm gonna start beginning writing of my abstract. What are the various questions that should be in my mind and answered before I even begin writing? So first of all, choose your specialty in which you want to write an abstract. Let's say I am interested in cardiology and I want to write an abstract in that. So what specific part of cardiology, what specific category of cardiology am I going to write an abstract? So the categories can be a lot. This year there were 61 categories in American College of Cardiology's conference, and I have given few examples from there. It can be electrophysiology, it can be heart failure, it can be cardiomyopathies, it can be electrocardiogram. Once you have chosen your special category, where are you going to submit your abstract? It can be multiple societies, it can be conferences, it can be meetings, it can be even some journals like PubMed. So once you know that, let's start by giving some examples. You can see the societies are European Society of Cardiology, American College of Cardiology, there is Society of Cardiovascular, Angiography and Interventions. So these are some examples of the societies. And regarding conferences, there can be multiple conferences as well. Two conferences are coming up and I will use them as example. which are International Cardiomyopathies Conference and International Conference of Electrocardiogram. And you can submit your abstracts here as well. And regarding further details, you can go to the website World Academy of Science, Engineering and Technology, where you will find the details of all the conferences that go around the year. So make sure you check out that website. Now, once you know your category, once you know where to submit it, what is the deadline of submission? So the Medics conference, which is going to happen this year, the deadline for their date is 15th March 2021. So where you want to submit it, make sure you know its deadline and what is the word limit. Now, word limit is very variable. It depends from each journal and it varies from conferences to societies. Everyone has their own word limit. So let's give you some quick examples. As you can see on top, you can see that Medics conference this year required that abstract should not exceed 300 words. Okay. While the American College of Cardiology allowed to up to 1900 characters. Like you can write 1900 words, in which 600 words can be your images. Usually the abstract is less than 300 words, but like I can show you from examples that they vary. And now, once you know about the word limit, what are the formatting requirements that each society requires from you? And they are also different from each society. So first of all, what is the formatting requirement of ACC, American College of Cardiology? It requires that you begin with the background, then you talk about the methods, then the results, and you draw the conclusions. 4 subheadings. While when you talk about the Society of Cardiovascular and Angiography Interventions, they require a different format, which includes you begin with the objectives, then you talk about the background, then the methods, results, and at the end you draw the conclusions. So 5 subheadings for SCAI, while 4 for ACC. And the word count is also different. Word count for SCAI is 250 words. Let's take another example. This is an example of an abstract, and I will show how it relates with the guidelines. So first of all, you can see the format. It begins with the title, then there are aims. After aims, they have combined methods and results. So 2 things under the same heading, and at the end they draw conclusions and they finish it with the keywords. So what are the guidelines? They show that it should be less than 250 words, and the abstract should be under the following headings. Aims first of all, number 2 materials and methods, number 3 conclusions, and at the end the keywords. Now what are the various types of submission that you can do in societies or journals? So first of all, you can have an oral presentation at a conference where you will go and talk to the viewers. After that, this year another presentation has been introduced which is called pitch presentation. In this example, in this presentation, there is a pre-recorded 3 minutes video in which you talk about your research, in which talk about the problem which you are trying to solve through your research. And apart from that, at conferences, you can present your posters. There can be electronic posters, there can be electronic exhibits, and this is an example of that poster which is presented to a conference. Now, I know that I should know multiple things before starting an abstract, which includes what is my specialty, where I want to write it, where do I want to submit it, what is the deadline of submission, what is the word count, what is the formatting requirement. Once I know these 5 things, and 6 being type of submission, how am I going to write an abstract? The main question is how to write it, but before writing it, you need to know the qualities which will make your abstract look very effective. So what are the qualities which make my abstract look very effective? First of all, make sure you add no other information apart from what has been written in your research paper. Just summarize that part instead of adding something new. And also do not reference any studies in your abstract. Second of all, make sure you structure it properly. Begin with the introduction, then the body of the abstract, and then at the end add the conclusion. So introduction, body, conclusion. This is the structure for your abstract. Make sure you follow this and the formatting requirements. At the end, the language of your abstract should be very simple and concise so that it can be understood and apprehended by a large audience. Don't use complex languages. It is not appreciated in the conferences. If you're using simple language and it is appreciable by a larger audience, it is better for you. And at the end, make sure that your abstract can stand on its own without the research paper. You don't have to read the research paper to understand your abstract. Just reading the abstract determines what the kind of research paper you have written. Starting now. How to structure your abstract. Now you need to know basic structure. The top of the abstract begins with the purpose and motivation. Why is this study so important to your field? Or why is this study so important to a lay reader? A person who has no idea, how will they benefit from your study? What is your motivation? Second of all, what are you trying to solve through this study? What is your research trying to better understand for everyone? So what is the problem you are trying to address? Third of all, what materials and methods have you used, or what approach have you used to reach your data or to derive your data? Once you have done that, what has your study yielded in concrete form? What are your results? And once you have your results, what conclusion can you draw from it? How this result is helping us in our field, or how is this helping the wider world? This is what you need to conclude. So this will be the structure of your abstract. Now I will quickly give you some examples of abstract. As you can see, this is an example from New England Journal of Medicine. I have added the reference. This is a structured abstract, meaning it has subheadings. Now you see that the title is Multi-System Inflammatory Syndrome in Children in New York State. In the background you will read that they are trying to associate whether MISC, Multi-System Inflammatory Syndrome in Children, is related with coronavirus disease or not. So in methodology, they carried out a descriptive analysis and they try to address three things. What are the clinical presentations of these patients? What are the complications of these patients? And what are the outcomes of these patients? And these three must be highlighted in the results for the sake of the betterment of abstract. So let's begin. As you can see in the results section that they try to address the clinical presentation. That the patient presented with fever or chills. Almost all of them, 97% had tachycardia, 80% GI symptoms, 60% rash, and so on and so forth. So clinical presentation have been addressed in the result. Elevated C-reactive proteins, elevated troponin. So these were the complications. And what are the outcomes? So they addressed that 80% of the patients were admitted to ICU and out of them 2 died. In conclusion, we have concluded that MISC is coinciding with the SARS-CoV-2. So what we addressed in our background, in our purpose, we have concluded that in our conclusion. Another example. Now this is an example of an unstructured abstract. Now once you see an unstructured abstract, it is very different from a structured abstract. Unstructured abstract is just like a paragraph. It begins with a title and goes a paragraph without any subheadings. Now whatever headings you see in this paragraph, they are added for viewers' discretion, their convenience. Otherwise, once you follow that link, they were not present in the actual link. So the title is How Estradiol Protects Against Ischemic Injury. So our purpose or motivation of writing this abstract is whether the estrogen replacement therapy in postmenopausal women can enhance or reduce their chances of stroke or some neurodegenerative changes or thromboembolism or not. So we are trying to find whether estrogen protects them against ischemic injury or not. So they devised a method in which they ovariectomized the rats. They removed the ovaries of the rats. So after that, they were expecting ischemic changes in the rats. They implanted some rats with capsules of estradiol, while some rats were without that, acting as a control group. Later they found that the rats pre-treated with estrogen capsules or implanted estrogen capsules, they had a better control of ischemia as compared to those rats which had not been implanted with estrogen capsules. So it was seen in the results that rats which were implanted with the capsules had better control over the ischemia or the infarct size as compared to rats which were not pre-treated with the estrogen. They had a worse control over the infarct. So in the conclusion we can see that estradiol pre-treatment reduces injury or specific to ischemia. Now we will talk about the abstract of a case report. The case report abstract is different from structured or unstructured abstract. Case report abstract begins with the title and name of author. Then we talk about the background, the introduction, then about the case presentation, then discussion of the case, and at the end what conclusion have we drawn from the case. So this is an example of a case of thoracic trauma. We are going to talk about the diaphragmatic herniation or diaphragmatic rupture secondary to thoracic trauma. Primarily, there was a thoracic trauma which resulted in diaphragmatic rupture, and what are the complications that will result in this case. Let's talk about that. So in introduction, we can see that diaphragmatic rupture is very rare and it only occurs in 1 to 7% of the patients. Now after that, the main pathophysiology of diaphragmatic rupture results due to the change in intra-abdominal pressure. Now about the case presentation, there was a 71 years old African American guy who met a roadside accident. He was taken immediately to a local trauma center, and his chief complaint was that he had left anterior chest wall pain. On checking his vitals, he had 98% oxygen saturation, which was normal. He had 16 breaths per minute, respiratory rate was normal, and his heart rate was 76 beats per minute, which is also normal. Later on, his chest x-ray was carried out. It was found in his x-ray that he had multiple rib fractures, he had a diaphragmatic herniation, had diaphragmatic rupture, his intestinal loops were herniating into the chest cavity, and he had hemothorax. And he was taken to the operation theater immediately. His laparotomy was conducted. An incidental finding during the operation was that his spleen has been lacerated. So during the operation, his diaphragmatic rupture and laceratory spleen had been taken care of, and the operation was successful. So in the conclusion part, we can see, or it is written in discussion here, but actually the conclusion is that the prompt and accurate diagnosis of diaphragmatic rupture leads to a better outcome in the result. Now moving forward, some quick tips for abstract writing. Once you have written an abstract, make sure that you always revise your abstract. Once you go through your abstract again, you will be able to better judge yourself that whether your abstract is going in a flow, whether there are any spelling mistakes, whether there are any grammatical mistakes. So make sure you revise it. If you have any material in your abstract that you find is repetitive, is occurring again, or is unnecessary, you should always remove that, because your abstract should be very short and concise as shown in the definition of abstract. This is another example of an unstructured abstract. You can see this is very short and concise, and it is not more than one paragraph. It can vary according to the requirements of the journal, but majorly your abstract should be very short. Okay, now quickly, what are some do's and don'ts of writing an abstract? So first of all, you should never manipulate your data. Don't cook the data. Always derive the data on your own and use statistical analysis for drawing your results. So I'll give you an example that you can see. The title is Lower or Higher Oxygenation Targets for Acute Hypoxemic Respiratory Failure. This is the title of an abstract. We don't need the details, but we just need to see how they are deriving their results. So they use statistical analysis, percentages, mean values, risk ratios to derive their results. Now what you need to do is that address your purpose in the beginning, and once you have addressed the purpose in the beginning, make sure you address the same purpose in the conclusion to show how you have completed your research. You can't make up your own conclusions. It doesn't make sense, right? So let's say, take an example that this research is trying to prove acute myocardial infarction after laboratory confirmed influenza infection. So the purpose of this research is to evaluate the association between MI and lab confirmed influenza. So in conclusion, you can see that they found a significant association between respiratory infection like influenza and MI, myocardial infarction. So this is an example of a good research, that how a purpose is addressed in the conclusion. Now, what you need to do is use the words like we did this, our research indicates that, instead of saying I did this, my research indicates that. Now I will conclude my presentation with three main reasons for the rejection of an abstract. What can be the possible reason that your abstract is getting rejected? The top of the reason is that your abstract is very general. There are a lot of studies already done on that topic, or your research topic is not unique, it's not eye-catching. So what you need to have is a novel idea. Bring new ideas to the table, have a very unique topic, and do research on that. So the second main reason could be improper formatting. You are not following the formatting requirements of that specific society, that specific conference. The most part of my presentation, I try to highlight the point that every society has their own formatting requirements. Every journal has their own formatting requirements. So make sure you are following the instruction for authors for that specific journal where you want to submit your abstract. And third and last reason would be that your abstract is not very relevant to the society. A neurology abstract will obviously not be relevant to cardiology society. So there are different societies, there are different fields. So what you need to do is that make sure that you are applying in a relevant society. or let's say you are doing a very specialized research, highly specialized research. You are doing a research on interventional oncology. Then make sure you present this abstract in the Society of Interventional Oncology or in their meetings or in their conferences, so that you go to the specific society for your specific abstract. So that's all for today. Thank you so much for watching this video. If you have any questions, please leave below. And I will conclude the discussion by stating the motto of our group: never give up, never lose hope. Thank you so much.